Good afternoon, my name is Jasmine and I'm part of Group F. We'll be presenting our critique on the article called Person-Centred Interactions Between Nurses and Patients During Medication Activities in an Acute Hospital Setting, Qualitative Observation and Interview Study. The title is extensive however thorough. It clearly indicates the reader's aim of the study, who was involved and how it was conducted. The abstract is also very thorough and covers all necessary information. The research problem, question, aims and objectives, results, discussion, conclusion are all clearly identified. However, the method is brief and lacks explanation of other sections. The other sections were given. Bolster and Manius present a background of information on the concept of patient-centred care. The reader becomes informed of the link between person-centred care and the high-quality healthcare. It is made apparent that, at the heart of person-centred care is a therapeutic relationship between nurse and patient. This can only be established through an understanding of patient's beliefs and values. This individualised care provided by the nurse promotes patient participation and inclusion. The introduction follows logically as Bolster and Manius provide rationale for the study. They put forth the notion that medication activities are adequate time to examine nursing practice and evidence of person-centred approach. As medication activities involve patient-nurse communication, education and interaction. Almost every patient will have medication administered to them during their stay in the hospital, thus providing the basis for exploratory study into how person-centred care is delivered during medication rounds. Bolster and Manius adequately discuss 9 articles of research conducted on medication activities are carried out in different settings. According to Beck and Tatano, this is vital in producing a sound literature review. Previous research identified how medication activities are routinized, traditional, nurse-dominated, and task-based, highlighting the lack of individualized care, thus incongruent with patient-centered care principles. Bolster and Manius contrasted negative findings with a study conducted in a community health mental setting where nurses build therapeutic relationships with their patients. In doing so, they successfully provided individualised and holistic care to their patients. Bolster and Manius demonstrate the ability to praise previous research in stating the limitations of the findings, not incorporating a patient-centred framework or focusing on medication education specifically, therefore providing gaps for Bolster and Manius to fill. In regards to the problems, aims and objectives, the publishers discuss problems regarding to the delivery of patient-centred care. It is suggested that although person-centred care is widely supported by literature and known by nurses, there are also multiple interpretations. Also, person-centred care is not as straightforward as it seems. It is not without its challenges and complexities that impede its delivery. Bolster and Manius identify the lack of research in interactions between nurses and patients during medication activities. This problem leads them to the aim of the research, which is clearly stated towards the end of the introduction. The aim, to examine the nature of interactions between nurses and patients during medication activities in an acute care setting with an underlying philosophy of patient-centred care, is highly comprehensive and descriptive. The publishers go further to state the research question, breaking it down into 2 dot points and then define medication activities in regards to the study. The research question is achievable and leads logically to the aims.
G'day Julia, this is Aisha, and now I'll be presenting the remainder of this, the second part of the presentation, and this will involve talking about the design or the method, the participant that took part of the presentation, and then that will follow I'll be talking about the tools and the procedure, and finally I'll conclude with the data analysis. Okay, so the design of the study is well articulated and explained by the publisher. There were 2 methods of the data collection employed in this study. The first approach focused on carrying out comprehensive structured interviews that involved both nurses and patients. The second method involved observing the nurse-patient interaction during medication administration. The purpose of these 2 methods was to enhance the richness of the data collected and to direct the reader to a realistic view generated data that is not based on random survey or controlled trial. Therefore, we find that the method is consistent with the aim of the study. This is evident by the interaction between nurses and patient during medication administration in an acute setting with underlying philosophy of patient-centered care. This study was conducted in an acute 20-bed ward in a busy metropolitan hospital. This hospital was chosen to be the perfect environment for this study to thrive due to the common shared principles of patient-centered care between the publishers and the hospital nursing staff. The researchers conducted an information session where nurses were invited to present their interest in the study. 11 eligible nurses were selected using stratified sampling technique. They were then randomly selected based on various clinical experience, ranging from 2 to 4 years and greater than 4 years. Whereas 16 patients cared by these nurses also were invited to join the study. They had to meet the following exclusion criteria. These patients had to meet the following exclusion criteria. Those less than 18 years of age, non-English speaking patients, and those who were unable to give consent. This sampling process is appropriate. However, it may not represent the wider population successfully. It involved participants that were elected and volunteered. Therefore, it allows for a biased opinion to happen. Now I'll be talking about the procedure of this study. A quantitative approach was utilized in this study, containing 2 selective methods: naturalistic observation and semi-structured interview. Naturalistic observation involved the participant watching the nurse, which is the observer watching the nurse-patient interaction during medication administration, and thus audio recording the activity. Each nurse was followed and observed for 2 hours. This lengthy time frame guaranteed a comprehensive data were collected, including patient education, patient interaction, and communication with multidisciplinary healthcare team members. Semi-structured interviews were conducted as a second data. These interviews were conducted separately with the nurse and patient respectively to ensure honest and straightforward response. In addition, the interviews were audio recorded to assist with further data analysis. The data collection of this study occurred between July and September 2007. The data analysis of this study aims to understand the bigger picture of the information collected. The researchers provided rationale for utilizing a framework process to analyze the information. They also adequately discussed what the process involved. Throughout this study, the data analysis is clearly explained, and it fits undoubtedly with the collected data. And now I'll present to you Ela, who will be taking you through the last part of the presentation. Thank you.
Hi, I'm Ela, and I'll be presenting the last part. Bolster and Menius present a very thorough, detailed, and extensive results section. Tables and quotes are incorporated within the text to further highlight the researchers' findings. Vogel states that credible results sections should not include any omissions in the tables, as this discredits bias. The writers have successfully used the tables 3 and 4 to promote clarity of the text. The 2 tables provided are presented logically and include all the relevant information. There are no comparisons of results from other studies within the text. The results highlight 3 major themes found in the research data. Those being provision of individualized care, patient participation, and contextual barriers of providing person-centered care. These themes are then thoroughly elaborated and supported with participant quotes. These all link directly back to the aim of the study, which involved examining interactions between nurses and patients during medication activities, with an underlying philosophy of patient-centered care. Now, first and foremost, the discussion is appropriately relevant to the study design. This section of the article provides a comprehensive discussion of the results. The researchers effectively integrate previous research findings to compare and contrast with their own results to provide a sound evaluation. The previous research that is referred to is all relevant and logical. The three major themes mentioned in the results sections are effectively discussed and are elaborated on in the discussion. However, they are concealed within the discussion and not as obvious. Although this is a weakness, it also allows for the researchers to evaluate their findings in depth. This allows a holistic analysis of the data collected. In this way, the researchers effectively combine the themes identified. The conclusion is where the researchers fall short. It does not follow logically from the introduction. In comparison, the other sections in the article, it is not as detailed or thorough. It states that nursing interactions with their patients are incongruent and with patient-centered care. The researchers neglect to acknowledge the positives from their research. Some nurses do not follow the patient-centered care principles. These are referred to in the discussion and are a major contribution, however, not stated in the conclusion. The conclusion is successful in indicating the usefulness of the research. It is made very clear that nurses need more education around patient-centered care. Although multidisciplinary communication was highlighted as one of the biggest challenges in delivering patient-centered care. This is the researchers' reason for recommending this area for future research and improvement. Bolster and Manius clearly state that ethics approval was granted before commencement of the study. It was ensured that all individuals that interacted with the research process were informed on the study and its aims. Patients and the nurse participants all gave consent prior to the observations and discussion. Confidentiality was also ensured throughout the data collection process. Individuals also had the option to withdraw their conversation from the research data. There were no problematic ethical issues relevant to the study. The researchers identified two major limitations in the study. The one main identifies a problem with recruitment of one acute care setting. Although the researchers identify the impact that this can have on transferability, they also justify ways that this limitation is overcome. The researchers provide a similar rationale for the second limitation identified. They state that nurses involved in the study may have demonstrated an increased awareness in communicating as a result of being observed. This too was controlled for as Bolster and Manius utilized strategies used by previous research to minimize the bias this could have inferred. The references seem to be relevant and appropriate to the study. Bolster and Manius incorporated 50 references to support and enhance the credibility of the article. The books and the journals used are accurately referenced and sources were cited clearly. The authors have not misinterpreted or misrepresented references cited, which can be justified through reviewing references. Now, in summary, Bolster and Manius present a research of high standard. The introduction follows a logical explanation of the concepts of the patient-centered care and provides sound rationale for the research aims. The aim and research question are easily identifiable and achievable. The research utilized two simple data collection to simplify the connection between the objective and procedure of the study. The participants of the study were selected on the bias of stratified sampling. This implicated a biased opinion to occur. This is allowing a wider population to participate. The procedure of the study was coherent and easy to follow. The researchers effectively discussed all aspects of their results, incorporating quotes and presenting themes. However, there is no comparison of the results to other research in the section. The conclusion isn't as thorough as other aspects of the article and neglects important information. However, it is clear on the necessary improvements to be made in nursing practice and on recommendations for future research. Bolster and Manius provide evidence that supports some nurses' successful delivery of patient-centered care. There is a major contribution to the research field as most previous research has found a large majority of nurses fail to meet the principles or individualized care. Due to the qualitative nature of the study, themes were identified. These themes indicate which elements of the patient-centered care impacted its successful delivery. Thus, the research provides clear areas for improvement. Multidisciplinary communication is new challenge to patient-centered care. The researcher brought this issue to the light, stating that it is an area that needs further research. Thank you for listening. That concludes our PowerPoint.